Good afternoon, everyone. And thank you for all those who came out to help us save HCMC. While the weather could be just a little bit warmer, recent history has shown that a little cold doesn't scare Minnesotans away from fighting for what's right. My name is Jeremy Olson-Ehlert. I am a proud registered nurse and a tri-chair at Hennepin County Medical Center. And I'm also MNA Second Vice President. We're here today at a pivotal moment in HCMC's long history. This is a moment when every one of our patients is at risk of losing the care that they deserve. A moment when Minnesotans in rural communities may be forced to stay in facilities that cannot provide the level of care that they need. A moment when healthcare workers who give everything they have to their patients could lose one of the most valuable training hospitals in the state of Minnesota. 13 years ago, I moved from North Dakota to start working at HCMC, knowing how vital of a mission-driven level 1 trauma center is to this region. And I wanted to be a part of that journey. HCMC is unmatched in handling the toughest emergencies for patients across Minnesota, from Minneapolis to the Iron Range and to the Iowa border. And I'm terrified to think about where I would bring my child after a serious accident, my spouse during a medical emergency, if HCMC is no longer there. And for families across greater Minnesota, the fear is even bigger, because HCMC is often the place that they depend on when local hospitals cannot provide the level of care that's needed. Losing Hennepin County Medical Center would devastate our entire healthcare system. As a safety net hospital, Hennepin County Medical Center treats everyone, regardless of their insurance, their income, or their circumstances. We know healthcare is a human right, and our mission is to provide it to everyone. Federal cuts in the passage of H.R. 1 are pushing safety net hospitals like Hennepin County Medical Center closer to the edge. We need steady federal healthcare funding and representatives in Washington who will protect hospitals that serve everyone. But right now, Minnesota leaders need to step up to keep HCMC open and running. Financial instability and recent cuts have already caused staff losses and service disruptions. We cannot afford to lose any more. And that is why I am calling on all of you. Get your friends, your neighbors involved in this fight. Call your state legislators and demand they do the right thing. Secure long-term funding for HCMC before May 18th. Because our patients are counting on it, our communities are counting on it, and most importantly, Minnesota is counting on it. Thank you.